أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. In the name of God Almighty, the most gracious, the most merciful, ladies and gentlemen, good evening wherever you are. And thank you for joining us in this third international webinar, which is organized by Interfaith and Inter-University Africa Forum, which is a joint project of Umma University, Tangaza University College of the Catholic University of Eastern Africa, and Harmony Institute. This webinar series, ladies and gentlemen, is to bring together interfaith groups and the faith-based academic institutions from across all over Africa in order to complement government efforts by trying to create awareness, contribute to capacity development, help in partnership building, so that we can organize a scholarly forum like this one, where scholars can debate and provide interventions to some of the issues that are affecting our continent. And I can proudly say that the first and second international webinar were dedicated to COVID, just the way this one is also dedicated to COVID. I want to take this opportunity to thank our esteemed panelists for joining us this blessed evening. Thank you for your time. Thank you for accepting to share your knowledge with us. And it is my honor to invite Father Abraham to start this webinar with prayer. Father Abraham, to you, please. Father Abraham, please unmute your mic. Your mic is off. Open it.
Okay. Thank you, Dr. Ali, for inviting me for this. And as an introduction to the prayer, I am a survivor of coronavirus. Just 2 weeks ago, I had a hard hit with my confreres, 25 of them with me. And actually, in this second wave of corona worldwide, we lost more than 20 brothers and priests. So the experience is vivid. Our prayer is a cry for help. And we join also millions who have survived in thanking the Lord. And also we join those who are under the very pain of coronavirus at the moment with their families. So let us start praying. Living and mercifully loving God, the Father of our ancestors, the Father of the people of the book, the Creator and the Savior of all humanity, as we raise our hands and hearts desperately, listen to our coronavirus cry. You have created us out of love for the fullness of life, but this pandemic is destroying the life and the livelihood you have given us. Help us to be more responsible people in this second wave of the pandemic, to save, to protect, and to cherish each other by wearing the face mask and keeping social distance. Grant us the courage which comes from you to stand in solidarity with those who are most affected. Merciful God, Allahu Rahman Ar-Rahim, we are aware of how African leaders' efforts, especially African Union, is working tirelessly to provide the vaccine at least for more than 760 million people within the coming 2 years. But they have financial and logistic troubles ahead. Help them living and loving God. Bless this golden plan of action. Guide and protect our religious, academic, and government leaders who have taken this sacred project of fighting COVID-19 through vaccine. As we show our determination to stand with our leaders and with everybody who strives to defeat coronavirus in Africa, bless us, Lord. Bless our webinar. Bless our panelists. Bless and move the hearts of all the participants and make us the instruments of your peace, healing, and protection of our brothers and sisters who are the most exposed to the coronavirus. Amen.
Thank you so much. May God Almighty accept our sincere efforts in all aspects. Dear respected audience, I just want to confirm to you that this forum is all about contributing to humanity. It's all about to promote dialogue. It's all about to promote partnership, and it's all about sharing of experience. It is my honor, ladies and gentlemen, to invite the representative of Umma University, Vice Chancellor Dr. Idle, who is represented by Dr. Hussein Ali, who is the registrar in charge of academic and student affairs. Dr. Hussein, to you, please.
Assalamu alaikum, and good evening, distinguished guests and our distinguished speakers. It is a pleasure to be with you. I'm here to represent our Vice Chancellor, Dr. Idle Farah, Dr. Hussein Ali, Registrar, Academic and Student Affairs. And I would like to be allowed to read his speech. At Umma University, we are proud of enduring and growing partnership and collaboration with Tangaza University College through Institute of Interreligious Dialogue and Islamic Studies and Harmony Institute. It was only a week or 2 weeks ago we held a joint workshop on living with disabilities in the religious and spiritual context. We are therefore delighted that we can close this challenging year of 2020 with a webinar on the most relevant theme of the year 2020, that is living in the new normal, emerging issues in the second wave of COVID-19 in Africa. I would like to thank the excellent panel of distinguished speakers and participants in this webinar. In particular, thanks to the professional panelist who is also a political leader, His Excellency Dr. Abdi Isa, the Deputy Governor of Isiolo County. And it is our prayer and hope that we will have a fruitful deliberations, and the outcome will inform how we deal with the COVID pandemic at the national, county, and international institutional levels moving forward into 2021. Happy holidays, and we pray for a great and prosperous 2021. Thank you, and God bless our partnership. Thank you, members.
Thank you so much, Dr. Hussein, for those kind words from our Vice Chancellor. And please pass our sincere regards that we appreciate this contribution, despite the challenges and the difficulties. Ladies and gentlemen, because of the interest of time, I want to take this opportunity to straight go to the speakers, our panelists. But before I do that, I just want to share with you that this inter-university and interfaith African Forum is committed to partner with any organization, whether private or public, so that we can jointly address to solve the real world sustainability problems affecting communities in Africa, affecting governments in Africa, affecting developments in Africa. Therefore, we as partners who have come together, believe that through interreligious dialogue and faith cooperation, we can contribute to the realization of the Sustainable Development Goals by championing social transformation and by also enhancing what we can call partnership, which were partnership for prosperity. So with those few remarks, it is my humble pleasure to welcome Dr. Nikai Sindebi from CDC Africa to share with us his thought on how shall we prepare for this new normal. Dr. please, to you, please. Dr. The floor is yours. Dr. Nikais?
Yeah, hello, please could you enable the screen, enable me to share my screen, please. Can you hear me?
Please, yes, or Father Abraham, can you kindly link with the, or you want to share? Please, can Brother Mustafa share the screen? Father, your mic is off. Father Abraham, your mic is off, please.
Good, good. I think I'm there.
Thank you. Thank you.
Okay. Please, my internet connectivity is not as good. So when we get to the question and answers, allow me to go in straight to the topic.
Thank you.
So thanks so much for inviting us, Africa CDC, to make this presentation. And my presentation will be in twofold. First, the current pandemic and the second wave that we're seeing across Africa. And then secondly, what are actually the measures in place through Africa Union, Africa CDC to really curtail this pandemic using different prevention tools like the vaccines. So let me start with the AP data. If you look at this trend in the past at least 10 months from now, so the first case, you all aware, it was in February. It took us about 133 days to reach 500,000 cases on the continent. So if we look closely, now it really took us about 30 days between mid of June to let's say early August to get to 1 million cases, confirmed cases, and then about 58 days to reach 1.5 million cases on the continent, and then lastly about 47 days to move from 1.5 to about let's say 2.3 million cases. So what is the point here? In this graph, you can see that on the left-hand side, we have about more than 2.3 million cases, and then we have about 56,000 deaths so far, unfortunately. So the point here is that we have a moving, a virus was moving pretty fast, and then also the virus is actually also spreading at community level. So the next point in this presentation, really, you can see clearly on this curve, then from sub-regions, the 5 sub-regions, the central, eastern, northern, southern, and western, that really we have moved into second waves. The first wave was around July, and then we're kind of entering the, we're actually in the second wave already. The red curve there shows you the 7-day moving average. And then you can see that within the first one, when we reached that first wave, we had more than 18,000 cases per day on average. And then later on dropped to about 7,000 cases per day. And then now we're back to almost 15,000 cases a day. So really explaining that we've reached really the second peak of, or we're all close to the second peak or in the second wave of the, or second phase of our pandemic. So globally, if you look at it by countries, so we have about 19 countries that will report less than or equal than 5,000 cases, 8 countries more than 5,000 cases, between 5,000 and 10,000 cases, and then 16 countries will report more than 10,000 to 15,000 cases. Only one country, which is South Africa, more than 500,000 cases. So that's the current epidemic on the continent. So let's break it down by regions. The Northern Africa, we've started seeing kind of increase, steeper increase from July to over November. And then now there's a drop, a significant drop of more than 23, decrease of more than 23% of cases in Northern Africa. In Eastern Africa, we have observed that you can see in August, this first wave, and now there's an increase of more than 5% of cases in Eastern Africa showing that we've actually reached the peak probably of the second wave in Eastern Africa. In Western, we could see after the first wave a steeper decline of cases, but from the beginning of November and early December, we've seen more than 52% increase of cases in Western Africa. And the same will apply to Central Africa with increase of more than 68% of cases in Central Africa. And the same will apply for Southern Africa, more than 100% cases. And South Africa specifically, if you pull it out of Southern Africa, more than 170% of cases have been observed of COVID-19 cases. Most significantly, that's the case of Niger. You could have said in September that they have actually were able to control the virus. They have flattened the curve. But as of the early November and then December, we have seen more than 1,000% increase in cases. And that's the worry now. Are we looking at a kind of preventive measure fatigue across the continent? That could explain that second wave that we're observing. Face masking probably has declined. All these preventive and social measures in place have probably also been waived at this particular stage. So overall, you can see that across the continent, we have seen a really increase in number of cases, which it's clearly showing that we've really have entered the second wave of our pandemic. So now the joint continental strategy has three pillars. The first one is on preventing transmission, and the second one is preventing death, and the last one is preventing social harm, economic harms, and also that's where we're looking at all the social distancing policies that have probably been neglected so far that have led to the second wave of this pandemic. The first one is where the vaccine strategy falls in, and that's what's going to take you a little bit. So we published a paper in October where we clearly stated that history must not repeat itself. And then there's a need for a global and continental cooperation. It's essential. So in this issue we're referring to, it's what I'm going to present on this slide, making a really analogy to the AIDS-related death. If you look at this slide, yes, so I was saying between 1996 and 2006, almost 10 years, taking analogy on HIV/AIDS, there were almost 12 million deaths on the continent. This was due to the delay in introduction of antiretroviral drugs. And this definitely led to those 12 million deaths I'm referring to, whereby you could see clearly that in the US, for this particular example, there was a decline in number of cases, in number of deaths in the US. So that's when we're seeing, or we're saying the history shouldn't repeat itself, in the sense that we should get access to the vaccines once needed for Africa. And we also need to be sure that we provide whatever will be required for the continent to be able to control this virus at this particular stage of the pandemic. So I think that's a very clear sign that the history shouldn't repeat itself. And then Africa should get really ready to be able to control this pandemic. So as part of the Africa CDC vaccine strategy, we have three pillars. The first one is to accelerate African involvement in clinical trial development. The second one is to ensure that Africa has sufficient vaccine supply. And the third one is to remove barriers to vaccine delivery and uptake on the continent. So how do we plan to achieve that? At the top continental level, President Cyril Ramaphosa from South Africa is the chairperson of the African Union, really called and endorsed a meeting and endorsed the Africa vaccine strategy on the 20th of August, 2020. So on this, the head of state and government stressed that Africa should take appropriate measures as part of the strategy to ensure that it secures timely access to COVID-19 vaccines when they become available. So we, as part of Africa CDC, have set up as part of the first pillar I did mention to you, a consortium called Consortium for COVID-19 Vaccine Clinical Trials on the continent. So those that you see in black there are actually sites that have been supported through the African Union, and some in orange there are those supported by other partners. So what is the plan? We plan vaccinating about 60% of the African population, and that's what is expected, and that is going to cost about 10 billion or at least 10 billion US dollars. And we plan then to secure about 1.5 billion doses. So we assume that 2 doses will be required by individuals. About 750 million individuals going to be vaccinated within 2 years. So again, as part of the strategy, the chairperson has established what we call the African Vaccine Acquisition Task Team. And the African Vaccine Acquisition Task Team aims at actually being able to secure resources to be able to procure enough vaccine doses, and also raise about 5 billion US dollars that will be supported for procurement. So these are actually what we know from the WHO. Africa, it has been really published, and probably you're aware that they've said we're going to get about 220 million doses for the continent. It means if you factor in 10% wastage, it means we have left about 190 million doses, and you need 2 doses per person. It means that we have 99 million people that will be vaccinated. And for a continent of 1.5 billion people, it means that we only have to reach like 8% of the populations. So as I mentioned earlier, the African Union aims at looking at 60% of that population. So basically, what do we do? What financing instrument do you have? You have the Afrexim Bank. We do have the World Bank, and the Afrexim Bank I mentioned also will leverage about $5 billion US to cover that. We have donors, and also the COVAX facility that you're aware of that will cover the 20% I did mention earlier. So why 60%? If you look at this paper by Roy Andersons, looking at about a rate of R0 of 3, in fact, we'll be expecting to look at 66.7% of the population to be vaccinated to reach at least herd immunity based on the calculations and efficacy of some of the vaccines that have been so far, the characteristic of the vaccine that have been published. So I'll start ending here to say it might be required at some point to need a COVID-19 vaccination certificate to travel. We've already seen Qantas, you've heard it from their CEO, that it might be required at some point to prove that they have been vaccinated against COVID-19 vaccines, COVID-19 really, to be able to become available, to be actually being able to travel in the next coming days or so. And this paper published by the Sunday Telegraph shows again that passport vaccine stamps will show which travelers have had their COVID vaccines. So we start getting there. So that's why we really want to be sure that we have at least a significant number of our population being vaccinated to be able to get to a level where we have free movement and free trades on the continent. Finally, I'm going to leave you here. We are looking at the whole of Africa approach, a unified continental strategy to ensure timely access to COVID-19 vaccines. Also, ensure we have alternative strategies on the continent, like the African COVID-19 Vaccine Initiative to complement COVAX in vaccine delivery. So COVID vaccines will be critical, 1, for human survival, 2, for security, and then lastly, for economic survival. Thank you so much for inviting us, Africa CDC, to make this presentation. And then we look forward for your questions. And then I also are looking forward to answer some of your questions. Over to you.
Dr. Nikais from the Africa CDC. first speaker for the good job, very current data with a lot of facts. And this presentation has really given me a lot of hope. So so Dr. thank you so much, and we shall come back to you once we are clear with the first series. I want to take this opportunity, ladies and gentlemen, to introduce our next speaker. Sorry, I forgot to read Dr. Nikai's bio. Please allow me so that audience can appreciate who was our presenter. Dr. Nikai Ndempi, ladies and gentlemen, is a senior science advisor, Africa, CDC, African Union. He's a PhD holder and is a specialist in virology from Kanazawa University, Japan. He's the director of laboratory research at the Institute of Human Virology, Nigeria, and adjunct associate professor, Division of Epidemiology and Prevention at the IHV of University of Maryland School of Medicine. He has published over 100 research papers in the peer-reviewed journals. Prior to joining IHV Nigeria, he headed virology lab at Ugandan Virus Research Institute, where he supported a cluster randomized equivalence trial funded through CDC and UK Medical Research Council. And subsequently, a multi-country randomized control trial on development of antiretroviral therapy in Africa, Uganda, and Zimbabwe. He's a site investigator, ladies and gentlemen, in the strategic timing of antiretroviral treatment. Insight, START, NIH, OMI. There are quite a number of formula here. He is a well-established scholar. He is also a member of the Farm Access Technical Advisory Board for the Pan-African Study for Evaluation of Resistance in Africa, PESA. Currently, he is a co-PI on 3 active NIH R01 grants and 2 CDC cooperative agreements in Nigeria. Dr. Nikai, thank you so much, and may God bless you for sharing with us your knowledge. Ladies and gentlemen, because of priority, I want to welcome Dr. Salim Hassanali, and please allow me to make his short bio. Dr. Salim is a pulmonologist and intensivist. He works at Aga Khan University Hospital. He undertook his initial undergraduate education at the Bhopal Noble College, Daipur, Rajasthan, India, where he received his BSc in 1985 before proceeding to Sri Ramchandari Abaj Medical College, India, Utkal University, where he graduated with MBBS in 1990. He earned his bachelor and master's medicine in internal medicine at University of Nairobi 2007. Later proceeded for his fellowship training at pulmonology critical care at the Charlotte Max Johannesburg Academic Hospital at University of Witwatersrand. He joined Aga Khan Hospital, Mombasa, as a medical officer 2004 before being appointed ICU or HDU registrar Aga Khan University Hospital. Dr. Hassanali, ladies and gentlemen, he is specialized in upper endoscopies, sigmoid scopes, flexible bronchoscopies, and ultrasound procedures. He is a well-established pulmonologist, and he has had a number of basic and advanced immunology training, ladies and gentlemen. He's a senior researcher who is interested in the pathophysiology and treatment of ARDS and bronchiolitis. He is an active member of the Kenya Association of the Physician Society of the Clinical Care Medicine, Kenya Medical Association, South African Thoracic Society, Critical Care Society of South Africa, and American Thoracic Society. Ladies and gentlemen, join me to welcome Dr. Hassanali to make his presentation on as one of our distinguished panelists. Dr. Hassan. Dr. Hassan, your mic is off, please. Thank you.
Bismillahirrahmanirrahim. Assalamu alaikum to all my brothers and sisters in faith and humanity. I don't know, thank you for your kind words. I'm not an expert, but having been in this pandemic for the past 8 months or so, I'll just give you my perspective and the things that I have seen, and these are my personal opinions. As of today, Kenya has recorded around 92,000 death cases, we've had around 1,600, approximately 1,600 deaths, and 72,000 have recovered. So it's with what is happening globally, both in Europe and in the United States, that 80% of the patients usually recover. The 1,600 you see are the critical COVID patients, and from my perspective, the second surge has really, really hit us hard. And I think the reason I foresee is that we've been complacent after the first wave. We've had very good outcomes during the first wave, but the second wave, I think we've tried everything, the new drugs, remdesivir, tocilizumab. They've even tried the steroids and all that. And when patients do come, they are really, really very, very sick. But the thing which I have sort of found to help my patients, which I start off immediately, are the antioxidants. I know there is not much of evidence there, but like I always say, that if there is no harm of these drugs, then there is no harm in taking them. And the antioxidants that normally I prescribe for my patients are zinc, vitamin D, and studies actually have shown that vitamin D, in those patients who have had very high levels of vitamin D, the outcomes and the severity of patients who do indeed get COVID-19 is much, much less compared to those who have very low vitamin D3 levels. And I've seen that in patients with, as part of the treatment, that when we do a lab profile protocol, we find that most of these patients have very low vitamin D3 levels. And that may be the reason why that one normally gives vitamin D. The other thing which I found, besides, of course, the recovery trial, which was one of the mega trials in UK, showed dexamethasone, especially in patients who do require oxygen. The other thing which I found to be of use is vitamin C and N-acetylcysteine, which are both antioxidants. They do not harm you. The most important thing which I will say from my personal experience as an intensivist and as a pulmonologist, having looked after a lot of patients with COVID, is proning. If patients do prone, it protects the lung. And it has been shown, like I said, when they present, present with, most of them present with respiratory symptoms, cough, shortness of breath, desaturating because they're gasping for air, but they're comfortable. Even if they're having very high respirates, they're comfortable. We try, there's always the debate, when do we intubate the patients? My experience in this second wave is that when we indeed intubate patients, our survival rates are very dismal. And the only problem that I foresee is that our testing of positive cases is very small. So we are testing less as compared to the Western world and Asian countries. I think we need to be more aggressive in testing all patients. The other thing is what the Reverend rightfully said, is wearing a face mask. I was in one of the other counties, and I found most of the people were walking without a face mask, and there was no social distance, or rather I would call it physical distance. So these are my take-home message. I think it's important as healthcare workers, I think we are going to see a third surge, especially after, hopefully, I pray and hope that we don't see a third surge during the month of January, but because of the festive season, and rightfully so, because, people are in the festive mood. But I foresee that there may be a third surge, and that may be, and what experts have shown, and from my reading, that this virus seems to be mutating also. It's not the same virus as what we saw initially. The other thing which I find, that to my surprise, we've seen, from what the statistics have shown, that if you've got diabetes, you've got you're obese, morbidly obese, your outcomes are poor. I've seen patients who are morbidly obese do very well sometimes. So I think genetics has a role to play, and maybe because we are in Africa, and maybe we are exposed to a lot of infections, maybe our antibody profile is much, much higher than those in the West or in Asian countries. That is my assumption. It is my personal opinion. But having said that, I think I've seen people lose their loved ones, both a mother and a son being lost within a span of 2 days. And that's very, very heartbreaking for me, especially because to lose in a family, to lose a son and a mother at the same time, making both a widower and a widow, it is very, very heartbreaking. And it's basically we have tried everything, every drug that is possibly available, we have tried on these patients, and unfortunately none seem to work, especially when they are intubated. And it is very, very heartbreaking. I just hope and pray that something, we are able to get the vaccine. I know this vaccine is expedited, but I'm a bit skeptical. Like I said, it's too early. We don't know what the long-term implications of this vaccine may be on us. Yes, the trials have shown positive results, but then we have to ask ourselves, yes, this may be given to those patients who are negative. What about those patients who are positive? What about those patients who have received monoclonal antibodies and convalescent plasma? What about pregnant women? What about breastfeeding women? All those have not been, there are no studies done on these vaccines, especially the Pfizer and the Moderna vaccine. And we also have to be cognizant of the fact that, they don't come without side effects. They tried it in UK, and there you saw that there were allergic reactions. So it's a Russian roulette that we are playing at the moment. We're trying this, we got nothing else to do, and we are desperate, and we have to use a vaccine. And I think hopefully by the time Africa receives it, we will have enough studies to see the safety profile. Hopefully, inshallah. That's what my hope is, that at least we'll have an idea how this vaccine works. And you see, like I said, it's a genetics also does play a big role. We don't know how it will work on us as inhabitants of Africa vis-a-vis inhabitants of Asia and in the rest of the world. So I think we have to keep an open mind, be hopeful, and keep praying. And that is my wish. I'm sorry, I have an emergency, so I have just taken a short time to give my perspective of what, but my urge would be to all those people who are listening to this, try and sleep on your stomach as much as you can, because when they do get COVID, and we tell them to sleep on the stomach, self-proning, what we call is, it becomes very, very difficult for them. If you can start now and practice that, but God forbid, should you get COVID and it's very severe or critical, then at least you can start doing that, and it has saved a lot of lives. Believe me, I have seen firsthand people who have required 100% oxygen have actually gone home without any oxygen. So this is my personal experience. So this is what I would urge all the members and all those people who are listening, that try and learn to sleep on your stomach as much as you can now, so that by the time, God forbid, should you catch COVID-19, you are at least comfortable in doing whatever we can. The rest is in God's hands, like I said. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for having me. And I hope this short presentation, I'm sorry, I have been extremely busy. I have not slept. And I wish this forum all the very best. And I pray that we should have some more of this, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh. May God and blessings be with you all.
Assalamu rahmatullahi wa barakatuh, Dr. Salim. On behalf of all the partnering institutions and on behalf of all the panelists and audiences, I want to take this opportunity to join you. You have really shared with us like rain. There are short rains that deliver quality water, which will really save millions of lives. May Allah bless you. May Allah make it as good amalu salih and your mizan, inshallah ta'ala. And we are very grateful. And I think on behalf of the partners, since you are on an emergency ward, we shall give you permission so that you can go and serve those very deserving souls. And may God, Jazakallahu khairan, on behalf of all these partners. Thank you so much. Ladies and gentlemen, I want to take this opportunity to proceed with our panelists again. And I want to invite His Excellency, Dr. Ibrahim Abdi Isa. Allow me to introduce His Excellency, the Deputy Ambassador, the Deputy Governor, Dr. Ibrahim Abdi Isa, he's a medical practitioner, currently Deputy Governor for Isiolo County. Dr. Isa has worked as emergency medical doctor and general practitioner in UK for 17 years. Dr. Isa graduated from Istanbul Medical Faculty and University College London. He did cardiology at Wellesley Hospital in Toronto. He has masters in health and social care management from Bradford University in the UK. Ladies and gentlemen, Dr. Isa, he is, as a medical practitioner, he is now in governance, and we expect quite a number of also lesson learning, experience sharing, the initiatives that is in place under the county government or even under the national government. Your Excellency, the floor is yours. Your mic is off, Your Excellency, please. Thank you.
Oh, thank you very much for availing me this opportunity on this topic of COVID. And this evening, I'm sure the internet has been giving us a little of hiccups. I want to take the last word one of the speakers has said, that you cannot fly if you don't get the vaccine. The CDC Africa is planning to vaccinate 60%. Hopefully the elderly, those with diabetic, patients who have comorbidities. So the 40% who are young and mobile will not be allowed to travel. That is, taking their civil liberties, which I think we should not be doing. Anyway, let me go to the topic. Now, much thinking has gone into this COVID. When it started, people started, taking the model of viruses, whereby the viruses, are seasonal, they come and go, and some of them can be potentially very hazardous. So with that, then when the COVID came, people started, modeling around that, and probably we had lost some few months to capture exactly what, and this had caused, a lot of very quick affection of people, especially children, who can be at a very high risk. So schools were a bit, people were thinking of closing, not closing, and then it all came. And hopefully in Kenya, in the situation in Kenya, we lagged a little bit behind, because when we saw, people were getting off the rail, people were being drawn to hospitals, people were having, these serious diseases. But then we had a plane load coming on March. Actually, I was not here. When this pandemic started, I was back in UK, and could not fly back to the country, and I was stopped at the airport because there was no flights. So I ended up 6 months in UK, and I took very part in that war of fighting the COVID. Then the WHO came very quickly and turned the tables and went into a very, very important message. That is, we find, test, trace, isolate, and support. This was the golden standard for fighting this disease. But then places like we come from, I come from the county of Isiolo, where I happen to be the deputy governor. We set up a laboratory, which is one of the best laboratories, I think, in northern Kenya, to look into the cases of COVID, how we can easily trace, isolate, and test. But then there came the problem of having the ingredients that is required to run those tests were taking very slow to come. They were finished very quickly. We could not get replenishment. And then we ended up in sending some of our results to places like Cambridge and other places. And actually, it took very long. Usually the turnaround should be around 48 hours. So we were in a situation whereby we had a lab which was working very well, but then we didn't have the ingredient to start mass testing of our people. And if you look at the position of COVID today in Kenya, we have, I think, just slightly over a million, slightly lower than million, 978 and something. Today we lost 11 people. But if you look also at the recovery rate is 73,000, over 73,979, which is very good. But then how many people are we testing? How many people are we testing? Where are we testing these people? How many labs? We have 47 counties. And today they were tested around one. How many were tested? Today, very few people were tested. Out of those, we got 11 people died. And the number of people who are tested were not more than, I think, 3,000. So how do we now come to the issue of fighting this disease? Number one, we need people to start trusting their government. We have lost that one, I think, on that. When we saw that money that is meant to fight COVID in terms of PPEs, in terms of masks, in terms of sanitizers that were given to KEMSA, it ended up in the pockets of very few people. And that, lost the confidence of a lot of people. Now you could see in many streets in the capital city, in our counties, people have started not believing that there's COVID because they have seen how our leaders were behaving. In the first wave, when it came, the government worked very hard, people joined the hands in the government, and we had fought the disease very well, and we brought it actually down, if you look at statistics. And then before the second wave, then we had the politician now coming in. And now we had politicians going into our towns and then starting doing rallies. There was no social distancing. People were not putting on masks. Then we have this second wave, which was much more worse than the first one. And actually the numbers, as our colleague from CDC Africa showed, in Kenya during the month of November, we had quite a very high, number of infections around the country. And because the message, again, did not go very well with the people. People were now starting to behave like our politicians were doing, that they were not practicing social distancing, there was no mask. And that was one of the worst, triggers of this mass infection that we had with this disease. Now, how do we managing this COVID, especially in the counties at the moment? Now the national government has said now counties are on their own. You have to manage, but then the funds are not coming. The funds that to deal with these, most of these hospitals have been derelict. It's not been looked after in the last 57 years. Now, then the baby, was thrown to you in the county. So how do you manage? We had already set up a committee to deal with the COVID, which involved the security, the medical doctors, the governors, the county, and everybody got involved. But then the message still, unfortunately, I myself had a victim of Corona, and it took 15 days for me actually to recover. Thanks God I recovered. Now, the most important message is to follow those three systems that we need to. Number one is we need to mask up. Everybody needs to mask up. This message has to be transmitted to everybody in the villages, down the counties, everywhere. Number two, because we don't have the funds actually to fight this disease. It's quite expensive, it's time consuming, it needs quite a lot of personnel, which we do not have most of the personnel in the hospital. As you can see how many doctors we lost during these few months of pandemic. So masking up, washing our hands, sanitizing, some of our areas, it is very hard to find water. So how do you now come about and around that? That is where then the sanitizers can come in. But then where is the funding to get that sanitizers? And then the social distancing. In the setup of Africans, we live in multiple societies where you can go in a home where you have more than 10 people living in the same room or in the same compound. So it becomes a bit difficult. So what we need to do is as we do that test and trace, I think it will be very difficult. Countries that have done, we should copy countries that have done very well. Country like UK has done very, very well. They have gone to 1, 2, 3 tiers, whereby when there are numbers that is showing the exponentially responses of the disease, then they lock down around those areas and set up, but they don't lock up the whole country, because it also affects the economic well-being of that. And then the most important also is contact tracing, because once you trace the contact, then I can give you an example that when we did a test, somebody sometimes in October, the result did not come until December. So this patient was complaining that we left them in a precarious situation. So if that person luckily did not turn out to be positive, if he was positive, 3 months down the way, the result has not come. So how many people will they have affected? How can we trace these people? So we need to put a very effective way of dealing with that. Then we need to build also our capacities in the counties, the 47 counties. And if you look at the number of doctors per ratio to members of public, it's 1 in 10,000, which is quite a very huge gap. So we need to build up our capacity very well. If you look also at the map now, if you go to countries like, most of the death I think occurred in countries up north, Egypt, Morocco, and down there, South Africa. But in East Africa, I think we have done very, very well in controlling this. In the whole of continent, as we can see, the doctor from the CDC has said is around 1.6 million people who got COVID cases. The West, and that when the COVID hits Africa, you'll find a lot of people who are on the ground who are dead. But thanks God, the thing that helps us, we have open spaces where people trade. Like even if you go to the markets, you can see there's open space. There's no closed markets. So it's the one which is helping. That one we leave for people to do that. Now we need to really look at how these communities infection rates are going on, and then we come up with a very strict mode of reaching these people and then educating them. And every meeting that we go now, or every time we go to the street as politicians, we need to preach that COVID is there, it is real, because a lot of our people do not believe, and that is very, very dangerous. We need to tell them it is. I always go out and say that it happens, it is there, it is real, and it also happened to me. So if that happened to me, it can happen to anybody. So we need also to look at rapid testing that can be tested. Countries like UK also, and Finland, I think, and Sweden are trying to test COVID detection by using dogs. So it's already, I think, a few weeks ago, I watched, it was in a station around Paddington in London, where the minister went out with the dog, and actually the dog had picked some few people who had COVID testing. So that's one way to go. And then the rapid testing. Rapid testing, I think Turkey has already, I think, is in the process of producing one test that could do through the saliva, where within a few minutes you could get it. And then we need mass investment, especially on the testing. Testing kits, the reagents that needs to be in the counties. We need to really support our counties. We ask the national government actually to look inward. And the only thing that can really bring down this is to really invest on testing, so that we can stop large transmissions, which has been noticed with patients who are obviously ill, and 40% of those people who are infected showed no signs and symptoms. They were considered asymptomatic, yet they account for 50% of the viral transmission. So we really need to look into this issue of mass testing, tracing and isolation. And I understand that the CDC, I don't know if my colleague, I was trying to listen to him, if he...
Your Excellency, Your Excellency, we shall appreciate if you will summarize, please.
Okay, I'm sorry. The most important, the CDC, they said that they are going to give 120 million affordable quality COVID tests. I don't know how far they have gone and when it is going to reach us. And I would like also to thank you everyone for joining this very important meeting. And hopefully, because of time, I'll bring it to show. Thank you very much.
Thank you so much. Please join me to thank
you very much,
His
Dr.
Excellency. Thank you so much, ladies and gentlemen, our respected audience and panelists. Allow me to thank His Excellency, the Deputy Ambassador, who is always a very close friend of Interfaith Initiative and Forum. Whenever we call him, he will never let us down. He's a man who always wants to be very active on the ground, and we're very grateful for the insight you have shared with us. I want to request each and every panelist to look at the chat box. We have a number of questions that has come in for all of the speakers. So kindly look at the question and then get prepared so that once we are through with our next two panelists, we start our questions. I want to take this opportunity to, it is my honor to welcome my sister, Reverend Esther Kamau, to also give us her side of the stories, her perspective, as far as this subject of the new normal is concerned. My sister, Dr. Esther, the floor is yours.
Welcome. Thank you very much. Welcome our viewers. We thank God so much. Hallelujah. We praise the Lord for his mercies endures forever, because it is the mercies of God that has enabled us to be here even today. I'm a minister of the gospel of Jesus Christ, and I represent women here in Kenya. My work have been for the last 8 months or 9 this year, doing the sensitization of COVID-19 virus or coronavirus. But previously, I've been doing the sensitization of HIV, the other viruses that have erupted in our land, like TB, even the polio. All these we have been doing the sensitization to women, because we know women are the ones who suffer most when such a things like this evil and a very bad pandemic in the land. Women suffer because they are the ones who give birth. They are the ones who carry the womb, the babies in their stomachs, in their wombs, so they suffer a lot. We try to sensitize them. We go to the rural areas, grassroots. We go to the urban areas, even reaching them to the hospital. And there has been a lot of fears in the area of women all over the country, because they are the ones who have kids, babies. They suffer a lot. But we know God is going to help us, because as priests, our work is to save lives. That is why we are involved in this sensitization. Even in our churches, we do the sensitization even in our churches, sorry. We do the sensitization in our churches, and all over the community. We reach out to the community to help them because it has been very serious. And during the month of August, it's like lower down. But then during at the month of September and over, we got this second wave of coronavirus. It has not been easy, but we have been doing it all over the country. We have been sensitizing our ladies. We have been sensitizing our children in schools. We have been sensitizing them to remember that it will not be there forever. As our colleagues have said, the number has erupted up, but we know as we continue to sensitize them, it is going to come down as we continue to wear masks, our women, our children, to wear masks, to wash our hands, to keep social distance. It is going to go down. As a priest, we have been doing the work of empowering women even in prayer so that God may remove this pandemic or coronavirus in our land. So as it has been increasing, mine is going to be very short. The increase of coronavirus or the second wave going up, to me, if there would be vaccine, it would be so good. But now the vaccine is a bit critical. But we know, even in our land, Kenya, there are young people who are innovators. Like there is a young guy that has innovated the nasal swabs here in Kenyatta University. And I believe that these young people can also innovate vaccine in our land, because the other viruses that has erupted in our land, it has only been stopped by the vaccine. Like polio, HIV, we have the medicine that we use, ARVs, malaria, we have got the medicine, we have got the others like these the others that have come, like malaria and others like TB, we have got the medicine. Now we believe also we want to ask the government to think of the vaccine, and especially in our land, that will be innovated in our land, Kenya, to stop this coronavirus, because this coronavirus is only going to be stopped by the vaccine like the others. Another point is our government is like has forgotten us, or like it has neglected the man, the mwananchi, the citizen, its citizens, because the treatment has been very expensive and the people are on their own. The sick people are on their own. There's no, the NHIF healthcare, there's no healthcare. And other people like the poor, they don't have money to cater for the sicknesses. So there's a lot of death. The death rate has gone up because people have no power of money. Why? Because when this coronavirus came in our land, many people lost jobs. Even ladies, young ladies, they lost jobs and they went into business. And this business, since people, the shilling have gone, or the shilling has gone down, the Kenya shilling has gone down, there's not enough money. There's not enough money. The business is not going on well. Like myself here, I also have a daughter who lost a job, and she's doing the work of masks, the work of, these sanitizers and the gloves. And it is not going on very well because there is no money in the land. The economy has gone down, especially on the area of the poor, on the grassroots. So we are pleading with the government just to try and see how they can support, or at large African or anyone, they can try and help us so that we may at least be able to put food on the table. There are some people right now, even affording mask is a problem. Affording sanitizer is a problem. Affording even the gloves to help in their work. So can the government look at these things so that it may just remember their people? The government, we are crying to the government as women. We are saying, government, please hear our cry. The government of Kenya, the entire Africa and the world, hear the cry of Kenya and remember us. And just look your eyes at the woman, because as I'm saying this and I'm repeating it, because church is the lifesaver. We save their lives in the heart by giving them the word of God, and even in representing them where they can be helped by the government, the NGOs, the well-wishers. That is our work, because sometimes you might not be able to give them food, to give them every small things that they would want. Yeah, so those are my points. I'm not going to give them so many. So our hope is the vaccine. Our hope is the vaccine, and our hope is prayer. Our hope is in the government and the well-wishers. We as women, you know, women are the most vulnerable. And to finish, the word that I'm going to finish with, I know my time is over. I'm going to finish with this word. A woman is a nation. A woman is the church. A woman is the family. A woman carries all men. Behind a successful man, there is a powerful woman. So remember, women. God bless you. Praise the Lord. Any question, I'm ready to answer.
Thank you so much, Sister Esther Kamau, for sharing that very good and inspiring experience from the grassroots groups. Ladies and gentlemen, I want to apologize that I forgot to read the bio of Reverend Esther Kamau, and here it is. Reverend Esther Kamau is a Kenyan who finished her degree at International Faith Theological Seminary, University in Nairobi. She's an ordained priest in 2005. She has been an active pastor in her church since then. She is married with 4 children. She's a Reverend Esther. Reverend Sister is a founder and a national director of Arise Women Foundation, which is doing great job at the grassroots level. And the Arise Women Foundation is part of the Evangelical Alliance of Kenya. She is one of the most committed in ensuring that women rights, women issues are brought to the fore for debate and discussion and for tackling. And she has done a great job as far as HIV, AIDS, poverty, and COVID-19 is concerned. Thank you so much, Reverend Esther. And please do there are a number of questions which have been raised. Kindly look at the chat box and then respond to them. It is my single honor and privilege to introduce Reverend Father Joseph Mutie. Reverend Joseph Mutie is an Orthodox priest for many years. He is a current chairman of Interreligious Council of Kenya. At the same time, he is a general secretary for the Organization of African Instituted Churches in Kenya. Reverend Mutie is an active member of Interfaith Council on National Response to the Coronavirus. So we are very honored really to have him, somebody who has been picked by the government because of his good job, to share with us his thought tonight. With other members of the response force, he has been organizing physical distancing protocols for all the religious service in the country, where dialogue has been organized with the government since the establishment of the commission. Father Reverend Joseph, the floor is yours, and thank you so much for joining us. Please welcome on board, and the floor is yours.
Thank you so very much. I hope you can hear me. Can you respond if you can hear me? Just a wave. Can you hear me? Hello, can you hear me?
Yes.
Oh, thank you. Yes.
Yes, Father, we are getting you. Reverend, we are getting you very well.
Thank you so very much. I want to begin by apologizing that I came in a bit late.
Reverend, please proceed.
Yes, I'm saying I want to begin by apologizing that I came in a bit late. I earlier alluded that I will not make it at 7:30 as the program indicated. But I want to thank God that I have managed to be here. I'm really grateful that the Umma University, Tangaza University, and the Harmony Institute are putting together very, very important people to discuss this issue. Allow me to observe all protocol. I see my my senior or my elder, the governor, Your Excellency. Good evening, and the different participants in this world. Thank you so very much for choosing to have us this evening. And it is true that there has been a lot of achievements despite the challenge that we are undergoing in this pandemic. It is true, in June this year, His Excellency the President, requested that religious leaders get involved in this fight. And through the Cabinet Secretary of Interior, for Interior, and also the Ministry of Health, the Cabinet Secretary Health, who were inaugurated on the 17th of June. Allow me to begin by saying we began by engaging faith communities and, having even physical consultative engagements to get to see how we get a standard template, to guide us to see how we work together. And we reached out both to Christians, to the Hindu community, and to the Muslim community. And together we continue to gather information. We also received some written submissions from, so many. Even we established a public portal where people could set their way of thinking, how they would think that we work to see how we mitigate. But again, we also co-opted or looked into getting some expertise. I want to thank God that we had people from the Ministry of Health, we had people from the universities of Nairobi, the University of Jomo Kenyatta, and it was a very elaborate discourse around COVID-19. But again, we went ahead and divided our approach into thematic areas where we looked at issues to do with funerals, issues to do with the worship, issues to do with sensitization, issues to do with compliance. But again, even as we continued, we met with the different county governors. There is the Council of Governors that meet. So we met them, and we had their way of thinking, and together we consolidated a report that guided us to see how we came out to develop some interim guidelines that we used to guide the different faith groups. It is important to inform that we also went around to the country, the different counties, and we together with the interfaith committees, interfaith council in the county level, formed the interfaith committees on COVID-19, which also cascaded the sensitization messages to the grassroots level. And in our guidelines, we considered age. We also considered the vulnerability of the congregation. We also looked at the duration of the exposure. We also looked at the social distancing, geographical risk profiling, but also the threats of the COVID-19 pandemic or the infection. Therefore, at the development of our document or our guideline or protocol, we chose to use the word guideline instead of protocol. As we developed the protocols, the guidelines, we adopted the 4 phases. The pre-opening phase, phase 1, and phase 2. And currently, we are in the pre-opening phase, is where the churches were, opened, but with minimal engagement. The opening phase is where the churches were opened, but also with some restrictions. But also, even in the second wave, where we also increased the number of church attendants and congregants, but also looked at the safety, of our people. So we also tried to see how we monitor our congregations at the county level, which is and even at the county level through the county committees, who also went down to the sub-county and the intra and the interfaith committees. And we thank God that we got a good reception even as we moved forward, and the people, the congregants, accepted our way of thinking. We also engaged the state through the Office of His Excellency, the President. We did some prayers a number of times, and we've been there working with our people as guiding and counseling them, but also working on stigma and exclusion. As you know, when this COVID emerged, there was a lot of stigma. People used to run away from anyone who sneezed. Even when you coughed, people ran away from you. So as religious fraternity, we worked together to see that we do away with the stigma and exclusion. That is what we've managed, and we are continuing in our work in this line, and we pray that the Lord will use us to see how we continue together working to salvage the lives of many in this country. Pray that the Lord will send us healing very soon. Thank you. I'm ready for any further engagement.
Thank you so much, Father Joseph Mutie, for that very useful insights which you have shared with us. Ladies and gentlemen, now we have is a time for questions, and I have got a number of questions from our audience who are watching, who are following us through the YouTube. And the first question is to Dr. Nikais, where they are asked, a participant is asking, how can we address the issue of vaccine skepticism? This vaccine is associated with many issues. So how can this skepticism be removed? Another question is, what are the possible obstacles that need to be addressed for successful vaccination process to take deep roots in African communities by African governments? That is to Dr. Nikais. If you can respond to those 2 questions, we shall appreciate. To you, Dr. Dr. Nikais, are you with us? Okay, as we are getting back to Dr. Nikais to come on board, I want Reverend Esther to respond to. There is a question where you are requested to respond to issues like emerging issues that affect women due to COVID-19 pandemic. From your experience, is there anything that you can say these are serious emerging issues that requires government attentions so that COVID can easily be mitigated and the life of these very important members of the society, women, who is a society, who is a mother, who is a child, can be saved or protected? So Sister Esther, to you, please.
Yes. there are emerging issues like pregnancies during these holidays. Let's not call it holidays. The schools were closed because of COVID-19, even today. So we have a lot of pregnancies in the villages, in the urban areas. Those are very, very high emerging issues because this coming together of young people or mating makes them infect coronavirus. Even young girls that are in schools right now, they are these emerging issues that are coming up, like this, when the women are giving birth in hospitals, and this issue of like if a woman goes to the hospital, she's giving birth, no relative can come near her. They have been stopped because of COVID-19. So I think these emerging issues like the pregnancies, like the stigma of the sick ones are not able to reach out to the relatives. I think we need help. And also the third one is lack of enough food, putting food on the table. Women are suffering. They are the ones who cook food. Yeah, they are the ones who take care of the family. Many of them have got fears right now. Many of them are jobless. Their businesses are not doing well. I think those are the emerging issues. And they bring along, they find themselves entering even into some to prostitution. And it is a very serious issue that needs help, especially on the side of food, because if they are able to put food on the table, then these issues can be controlled. Because if you have a little baby breastfeeding and you are going out there to sell something, how can you protect your baby from coronavirus? And your baby is breastfeeding, you need to stay in the house. So if the government can be able to provide them with the food, to provide them, with something like some cash or some meals, so that they may stay at home until this thing goes down, I think it will be better. Yeah.
Thank you so much, Reverend Esther. You have really brought in a very serious issue that is really at the heart of our communities, issue of teen pregnancies, stigmatization, loneliness, lack of food, and actually unknown fears which are also associated with this. Those are very important points. And as the champions of the people who are working in the heart of the communities, I think we shall be taking this matter on here, or we shall take this matter forward and see how best it can be addressed. But I hope the audience have benefited and they are aware that this problem are with us, because if
Yes.
there's no way somebody can live. So Father Joseph, kindly expound on the role expected of the religious leaders and institutions in combating or in trying to combat the COVID-19 wave 2, which is really devastating in terms of infections at the community level, which is spreading too fast. So what additional role can the religious leaders and institutions play? To you, Father Joseph, thank you.
Thank you. I hope I'm audible enough. Yes, this is very, very important. As religious organizations and as religious people, religious leaders, we encourage that we continue to work with our people. That is number one. Even in these difficult situations, let's not tire. Let's continue working with our people. Let's continue giving them guidance and, where possible, counseling. We know they have psychological challenges. We have challenge of terms of mental. We've seen how fathers are behaving and even mothers are behaving. We have seen how children are going through very difficult times, especially just like what my sister, Reverend Kamau, Esther, mentioned, the issue of teenage pregnancies and so forth. There is need for us to continue encouraging people. There's need to continue our provision. You know, some of our religious institutions have taken into giving food, providing masks, sanitizers, and the relevant items so that we keep our people afloat. Again, there's need for us to continue trusting our structures. Let's trust our government. We do not have any other states. We only have this country which we adore. And let's keep trusting our country despite the pitfalls that we are going through. Let's continue trusting our security actors. I know we had challenges before where the security actors actually went overboard. Let's continue trusting them. Let's continue encouraging volunteerism, because now we are seeing there's a challenge where the doctors are not even enough. Let's continue speaking out, raise our voices, so that government can provide for the health workers, those people who are the front line in this fight. We cannot tire. We continue to urge and we continue to pray that their needs are met, so that our people are served, get better services. But let's have a moment to continue capacity building, not only for the health workers, but everybody, because now, when this the infected people go to the home care for home care, people need to understand how to go about, guiding them, how to make sure that they are safe, and also as they keep these people who are infected safe, how do they keep themselves safe? So there's need for us to continue capacity building at all levels, in the church, in the mosque, in the temple. But again, let's not forget our philanthropic role. Let's still remember that we are called to serve God and humanity, and through that, God will be great. God will continue to bless us and will heal us. Thank you. Dr. Ali, we cannot hear you.
Father Joseph, we really appreciate your insight on this matter, whereby you have brought in the importance and the urgency that we need these services like counseling, touching lives in terms of giving something small, if it is even a sanitizer, a mask, or just giving a message of hope to people who are so much affected. We need to upscale voluntarism as a culture, and then also develop capacities at our institutional level, so that we can be able to do something small, but that can have a very positive impact on life. I also appreciated the audience and myself have appreciated that there is need to trust our government, since we don't have another one. So this is the best, since this is the only one that we have, the only country we have is Kenya, we have no option but to trust our government, so that we can work with them in a very close way. Ladies and gentlemen, it is my humble pleasure to invite Dr. Abdi, who has a number of questions, I must say. Dr. Abdi, you are being targeted, I must confirm to you, as a government to respond to a number of issues. First one is preparation by the government for vaccine acquisition and rolling out. And then you can compare, for example, what lessons can Kenya learn from the British by really becoming the first country to really invest and then start vaccinating its citizens. What lesson can we learn from that particular side? Then another point is there is this issue of vaccine skepticism, which was asked to Dr. Nikais. Please, as a practitioner, I think you are able to help us in demystifying that this vaccine is good for health or is good for a good cause, and therefore, so you need to comment on that. You are also requested to make a comment on how can you evaluate the interfaith and interfaith government and NGO partnership in ensuring that this pandemic are confronted and then brought to the level of management, for example. So, Daktari, the floor is yours, and we shall appreciate if you can comment on those few questions. Thank you so much.
Thank you very much, Dr. Adil. First of all, I would like to go straight and comment on the interfaith and non-governmental organizations. These are pillars of our society. If you take an example, the country I come from, we have more than 30 NGOs, and those NGOs come under my office. So what we do, we coordinate on the activities that goes around the county. There are many activities that they help in water, wash, sanitization, and they also help in doing defecation-free zones in the whole of the county. So we also get the PPEs we were supplied, hopefully from FCDC. We also got some from Equity Bank and many, non-governmental organizations that put effort. And we hope that this nature of volunteerism should continue, and every Kenyan should volunteer and be your brothers and sisters keepers, so that we look after each other, because this disease is very serious, and we need team up with everybody, including, but the interfaith and the NGOs are very, very important pillars in our society who encourage volunteering. So we really appreciate, and we hope they will continue doing that. Coming about, the next question was about the vaccine. Is it good or bad for health? If you look at seasonal flus that come, usually, as a doctor when I was working in UK, what we do, we wait during the summer, we prepare ourselves for the winter to come. That's when most of the elderly people are affected. So we carry a number of vaccination to them. And we also do to health workers on flu. And it really works and reduces the mortality rate among these patients. So the vaccine for COVID, which has already been brought to the market by Pfizer and other teams, there are a number of studies that have been conducted which shows that a very good effect. But as my colleague from the pulmonologist said, that we have not tested it on pregnant women, on breastfeeding and others. And those are trials that will continue as we go on. But it is very important that this vaccine will really help. And I think the vaccine will be good, and it will stop the spread of the COVID. There are many videos I've seen, many prominent doctors also saying that this vaccine is bad, it's going to go to the brain barrier, it will close, and it will go and change the genetics. And there are a lot of hearsays from here and there. And, everybody can put anything he wants on the internet, YouTube, so that, but it has not been proven. There is no peer review done on this. But according to the peer reviews I've read so far and the studies that I've conducted, it is a very good vaccine. And I hope that we will also get it, and that people should volunteer to be vaccinated, so that we can have also what we call the herd immunity. Now, what are the preparations? I think Kenya is very lucky because we were involved in the first trials of the vaccine, which has been very, very successful, and quite a number of Kenyans went, volunteered, were tested, and showed a very good response to the vaccine. So on this, our magnanimity of Kenyans of allowing those foreign companies to come and do their trials, I hope that they will be able also to look Kenyans in a good eye, so that we can get this vaccine, so that we can start vaccinating our people. You remember, we have 47 million Kenyans who are waiting for the vaccine. And I'm sure the Microsoft Foundation head, Bill has also promised that he will chip in to help in. And you can see the doctor from CDC said that there are already funds 5 billion that will be set aside and another 25 from other donors so that we can vaccinate 60% of the African population. So there's a good team that is working on that, and we are not lagged behind as Kenyans. And the government is working, trust me, the government is working day and night. You might not see it on the TV, but behind the scenes, the government is working very hard to acquire and manage the vaccination team. Hopefully, we will have the counties also being involved in this acquisition and preparation of the vaccine. And the other question was what lessons are learned from Kenya and compared to UK? I can tell you that I was in UK when the COVID was declared disaster in UK. What we had is that the public in UK are very trustful to their government. They listen and follow instruction from the government. So we had a very early lockdown, especially in London and all those big centers. And there was the masks were widely received and widely available. There was social distancing, which was very strict. And actually they brought down the disease, the COVID-19 in UK very well. In Kenya also, we did very well. We looked and compared ourselves and took some lessons from those countries like UK and Italy and Spain and what they were doing. And then we quickly managed to put a team, and that team went to advise the government and then put into systems that, and you could see that we really worked very hard as the government. We brought down the number of infection, and it went down until sometimes in around September, where again we lost track, when then the politicians started then coming out and started making massive rallies, and people who are not with masks and social distancing. And these are the things that is unheard in UK. You on public gathering and what it's massively restricted, and nobody goes against what the government in UK does. So we need to trust our government. We need to start following the instruction they're giving so that we can save our population and our country. And I hope with time, as time goes, people will now start, realizing that the importance of our government and the effort that the government has put in stopping. There are a few around who are not following the guidelines, but the government is very strict. The government is working on a number of issues, and I'm aware and I'm in touch about getting vaccination to our country, getting our counties to work together, to pool resources together so that we can have a very good result, so that we don't go on to third wave. I think at the moment, I'm very pleased that it's coming down. The second wave is coming down as people are starting to take precaution. Political rallies have been stopped, and you can see during our Jamhuri Day, it was only in Nairobi, and the president had stopped anywhere in the country. That was a very good move. So we hope when Christmas comes, people will be very, very careful what they do. Also, we need to reduce the number of people attending funerals. So that is where, again, things can get out of us. And I can see myself in my local mosque, they are really very strict. They are taking the mask, social distancing and sanitation very, very seriously. And I hope all institutions and religious organizations should take that one, and they should preach in the pulpit that we need to follow so that we save our country, because this is one of the best countries that God has given us. And I cannot compare any country to Kenya. And I feel very proud to be a Kenyan and very lucky to have a beautiful country like Kenya. Thank you very much.
Thank you so much, Your Excellency, Dr. Abdi, for those very good insights where you have really given us hope. When this webinar started, we were really not sure that the vaccine is coming to this country or if the government is even doing anything. But thank you for giving us the surety that a lot is happening at a higher level. We also appreciated the key messages that came from your presentation in terms of collaborative partnership, voluntarism, and then that this vaccine is good because it saves lives. And then you also We also appreciated your thoughts or contribution whereby we made a big gain in the first phase combating of the COVID-19, but politicians came and messed us up again. So we need to really be aware that we don't again sleep after we are making now these gains that is again emerging under phase 2. So I really want to take this opportunity to really thank each and every panelist for sharing your rich treasures with us. And I want to give just let me say 15 seconds to each of you to say a parting shot before we go to the next phase. And I want to start with Father Joseph. Father Joseph, your parting shot. You have heard what your colleagues have said. What are now please.
Thank you so very much. Mine is to say that COVID is real. People are dying. People are getting infected. And we need to be very, very careful. Let's follow the guidelines. But also, let's embrace the vaccine when it comes to our country. Thank you.
Thank you, thank you, thank you. There is no doubt that we expect the government will going to do a massive awareness campaign, and we have no option but to embrace the vaccine as a way of also appreciating the government's efforts. Thank you so much. May I give opportunity to His Excellency Ambassador, our Deputy Governor. Your Excellency, what is your parting shot, the final message to Kenyans and to the international audiences who are watching this particular third international webinar of Inter-University and Interfaith African Forum?
Thank you very much, Dr. Adam. My parting shot will be mask, mask, mask. Social distancing, social distancing, social distancing. And sanitize, sanitize, sanitize. COVID is real, and we need to save our population, we need to save our country, and we need to save our beautiful world so that we can live a very good world when we live. So my parting shot is COVID is real. Please take it serious. Thank you.
Thank you so much. These measures work. That is what His Excellency is saying. So we need to embrace it, my good international audience. That the only way we can handle this is we must appreciate the protocols that are measures that are there so that we can save lives, we save ourselves and our loved ones. To Reverend Esther Kamau, what is your parting shot, please?
Okay. My parting shot is, my message is to His Excellency, the President of the Republic of Kenya. I know that we have very learned people, very learned young people in our universities. The people can they can innovate vaccines and the disciples to check the coronavirus. They have that knowledge to do it. Can His Excellency, the President of the Republic of Kenya, kindly give these young people a benefit of doubt, because the only savior of coronavirus, number one is God, and number two, we have to do the vaccine. That is my prayer and my plea as a woman and as a mother. Thank you.
Thank you. Thank you. There is a lot of tweeting that is going on this matter. And this message, I am sure in one way or another, it will be picked by the social media and it will reach very far. Ladies and gentlemen, I want to take this opportunity on my behalf, on behalf of the partners, the technical team, to really thank our distinguished panelists, Reverend Father Joseph Mutie, Dr. Nikai Sendebi, Reverend Esther Kamau, Dr. Salim Hassan Ali, and His Excellency Deputy Governor Abdi Maalim Isa. So on my behalf and that of the partnering institution, Harmony Institute, Interreligious Dialogue and Islamic Studies from Tangaza University College of the Catholic University of Eastern Africa, Ummah University, ladies and gentlemen, I want to say thank you so much to each and every one of you. Thank you for joining us. May what we share save lives and benefit our society, our communities. And I want to invite Brother Mustafa Gek to move a vote of thanks on behalf of all the participants, all the panelists. Brother Mustafa, to you.
Thank you very much, Dr. Ali. Dear respected panelists, His Excellency Dr. Ibrahim Abdi Isa, Dr. Nikais Dembi, Reverend Father Joseph Mutie, Reverend Esther Kamau, Dr. Salim Hassan Ali, Father Abraham Hailu, our moderator, Dr. Ali Adan, our most valued invited guests, ladies and gentlemen, it's my privilege to have been asked to propose a vote of thanks on this webinar. I, on behalf of the Interfaith and Inter-University Africa Forum and the entire team, extend a very hearty vote of thanks to all panelists for gracing their important work and sharing with us their findings and opinions about living in the new normal and emerging issues in the second wave of COVID-19 in Africa, particularly in Kenya. We are all inspired by panelists' great valuable words and contribution. Thank you for joining us. Have a blessed day and night. Thank you.
Thank you, and God bless you all.
So this is the end of the program, I can say.
I want to
Yeah.
I want to move a closing prayer, ladies and gentlemen. That we have been interacting and sharing very important knowledge, very important experience, important developments as far as COVID-19 is concerned. At the African level, we have been joined by participants from different continents in the world, including and also different counties, different parts of this country. I want to, and this is the big blessing from the God Almighty, who is our creator. We thank God for all his blessings. May God forgive us our sins. May God bless what we have shared. Let it benefit and touch millions of lives and inspire them to change their behavior and attitudes. May God Almighty make us among those who will be useful to each other, to humanity, directly and indirectly. And may God Almighty take care of us. And I wish each and every one of you a safe travel if you are traveling. And thank you so much and have a blessed night.